Hey everyone, welcome back to another video. In this lesson, we're going to be doing the Stop the Bleed course, where we'll go through the lecture portion to learn all the information on how to stop life-threatening bleeding. And in class, we'll do the practical skills in person. All right, so a little bit about this course. Again, it's a national course designed to teach anybody how to stop life-threatening bleeding. And it's put together by these couple of organizations down below. So it really is a joint effort, and it uses information at the forefront of research on trauma and bleeding control to get the best practices out there for how to stop bleeding. Okay, so some images may be disturbing to some people. So this is again the lay rescuer, the lay person course. So none of the images in this one are too graphic. If there's any blood, it would be cartoon type blood. But it is important to remember, right, that when we're treating life-threatening bleeding, it could be a messy scene. There could be blood, a lot of blood, spurting blood that we need to deal with. And while it can be grotesque sometimes, it is important to remember that we have to treat that bleeding to save somebody's life, and it can only take a very short period of time for them to lose enough blood to pass away. So just keep that in mind as we're treating bleeding emergencies. Okay. And why do we need this training? Because the number one cause of preventable death after injury is bleeding. So most people die after a trauma from bleeding, which is really important. So where can we use this training? Where are some places that life-threatening bleeding might occur? Here's a just a graphic of some of these places, and it's not all of them. I think a lot of times in the news, the ones that get the most attention would be mass shootings, terrorist incidents, things like the Boston Marathon bombing, really, really bad incidents you hear about in the news all the time. But those are not actually the most common places that life-threatening bleeding comes from. I think most of them are actually come places where you are every day, right? Whether it's at home, at school, driving, in your workplace, or even just being outside, right? You never know when life-threatening bleeding can happen. And you need to be prepared to treat that in all places. All right, so with this course, there's really two goals to the Stop the Bleed program, and to really saving anybody that's has life-threatening bleeding. So the first is to identify life-threatening bleeding. We'll talk about what that looks like, being able to tell if somebody could die from the amount of blood they're losing or if it's just a minor cut. And then from there, right, the second goal is to learn how to stop the bleed. Again, because it is the most common cause of death post-injury, we need to be able to treat that effectively and quickly. And we'll talk about these, but pressure, packing, and tourniquets are really the three things we're going to talk about in this course. Okay, so first, as we always say, scene safety is your number one priority, right? If you get injured, you can't help others. You also might become an additional patient that EMS and fire have to treat. So it's really important to make sure that the scene is safe, that you're not going to endanger yourself to make more people injured. All right. If it becomes unsafe while you're trying to help somebody, stop, move to safety, bring that person with you if you can. All right. It's also to remember that blood can carry diseases, right? Bloodborne pathogens, and we need to protect ourselves from other people. Right now, we think about protecting ourselves using PPE. We hear it a lot right now with COVID-19, but it's important to remember that there's many diseases that you can get from somebody's blood. So if you are treating somebody with life-threatening bleeding and you have gloves available, you really should be wearing gloves. And depending on how much blood there is, you might need to wear a gown, goggles, face shield, mask, etc. All right. And if you get blood on you, as soon as you can, you really need to wash up, clean any of that blood off, and check in with your doctor or healthcare provider. Tell them that you're exposed and you can get tested. All right. So while we're talking about, or to start talking about bleeding control, right, we have this acronym ABC, or mnemonic, okay? And we've talked about ABCs before with patient assessment, right, with CPR. So it's kind of another ABC, and I think that's why they stuck with it, because everybody knows ABCs, right? So the ABCs of bleeding control are alert 911, B for bleeding, and C, compress. So those are the three most important things we need to do to stop bleeding. All right, so we're going to walk through these step by step. So first, A, right, alert 911. As soon as somebody's injured, right, we need to start that emergency response system. We talk about it all the time with CPR. the first thing, as soon as you find somebody unresponsive, even if they have a pulse and they're breathing, you got to call 911. You got to get that emergency response started. And we also talk about, right, emergency medical dispatchers will be able to walk you through and help describe how to either do CPR or treat some type of life-threatening emergency by giving directions over the phone. Okay, make sure you know where you are. Follow those instructions by the 911 operator. All right. So B, bleeding, right? We need to find the bleeding. If you think about our two goals, right? Identify and then treat life-threatening bleeding. So our first step for B in bleeding is to find the source of the bleeding. So we often talk about doing a blood sweep, right? With gloves on your hands if you can. If it's not obvious where somebody's bleeding, just doing a quick swipe down the entire body, checking your gloves frequently for any bleeding, all right? You want to look for continuous bleeding, large volumes of bleeding, and pooling of blood, all right? So you're going to look for anything like spurting blood, right? Like a sprinkler, blood that's pooling up onto the floor, or clothing that soaks up blood. And it's important to remember that just because you don't see a lot of blood on the floor doesn't mean that somebody bled or doesn't have significant bleeding, right? Our clothing can soak up quite a bit of blood that we may not even notice it. So looking for those factors is really, really important. It's also to remember that if you find bleeding, or if there's a really obvious one like an arterial, a spurting bleed, it's important to remember that they might be bleeding in other places too. So we need to check the entire body for additional bleeding. And again, check that clothing. If you feel really damp, red clothing, that's probably blood there. Okay. So where can we bleed from, right? Anywhere in our body, because there's blood flowing around our entire body. We kind of break it up into three different areas that we'll treat. So our extremities, which are our arms and legs, our neck, armpits, and groin, which we call junctional bleeding, right? The junctions kind of at your joints. And then trunk or body bleeding, all right? So these three areas are kind of the three areas that we might have to treat and try and stop that bleeding. And we're going to do each one differently based on the type of bleeding that's going on and how severe it is. Okay, so getting back to the ABCs, right? We now have C, or compress, right? And that word compress means to put pressure. And you can see this guy doing a great job here. He is leaning. He's got both hands. He's putting his entire body weight, really putting tons and tons of pressure over that injury site. So compression, right? Pressure. Applying direct pressure to the wound is the best way to try and stop bleeding. It helps our body, which naturally clots blood, it helps it do it faster. So focus on the location of the bleeding, and you want to use some sort of substance to stop that bleeding, to absorb the blood to help it clot. So usually a piece of gauze, whether it's a 4x4 or a big one, nice abdominal pad, or some sort of cloth, right? We got to remember that we may not have a first aid kit, bleeding control kit at our disposal all the time. So if you need something to try and stop bleeding, you can use a t-shirt, a sweatshirt, right? Anything you have type of cloth laying around. And hopefully the cleaner it is, the better, okay? So we're going to put direct pressure on a wound to try and stop that bleeding if we can. And if it stops bleeding, that cloth is not soaking through, that's great. Just wait until help arrives because you call 911 already. All right. And don't forget, if it's something soaks all the way through, right, we don't want to remove that clothing. So let's watch a quick video here on how to apply pressure. So again, you can see here she has let's say it's a leg, an arm, some type of, could even be a body cavity, right, where we have this injury, and she's taking her time. She found this t-shirt, put it over it, and she's putting her entire body weight, right? We generally want to put at least 3 minutes of pressure there to try and stop significant bleeding like that. And again, she's going to hold it until either it soaks through or somebody else comes to help her out there with more training. All right, so we talked about pressure. Now let's talk about packing. So for large wounds where superficial pressure or pressure from the outside may not be enough, we're going to want to pack that wound, especially for really big, deep wounds. If bleeding is from a deep wound, you're going to pack that gauze tightly into a wound until the bleeding stops. And I really like this pressure here because it kind of shows why we're doing it, right? You could see here that we have this large cavity, this large hole that, let's say, is bleeding profusely. You're going to take that roller gauze, that gauze that stretches out, and put it in one finger over the other here to really pack it from the bottom all the way up to the top. And you'll see it makes a really nice job of sealing this whole hole and allows you to put pressure throughout the entire wound, and it's going to allow the blood to clot in there. Versus if you were to just take a whole bunch of that gauze and put it on top, well, now this entire wound cavity is going to fill before your pressure and your clotting device really does anything. So packing the wound is really, really important for any of those big wounds that are big open wounds, especially if it's in the body trunk or a junctional, like your shoulder, where you can't put a tourniquet on. And in this video, we're going to watch this instructor pack a wound. All right, so we see here this instructor is taking out this quick clot, right? And again, quick clot is a bandage that has a chemical component to it that actually promotes blood clotting, right? And stopping it from bleeding. And you can see here, so we have this big wound. She takes it all out of the package and is stuffing it in one end over the other. So going as deep in as she can and filling it till it gets all the way up. All right, and it's important to note for both these videos, the instructors are going a little bit slower to demonstrate. You want to do this as fast as you can, right? Seconds are crucial when whenever you're treating bleeding, okay? And you can see here, so even though she's packed the wound, right, and filled it all the way up with that gauze, she's going back to that first step, which is pressure, and holding pressure over it and putting her entire body weight on there because it's really, really important, right? That pressure is what's going to stop bleeding. So even if we're packing a big wound, afterwards we're going to apply pressure to stop that bleeding. All right, so we watched her pack the wound there. And again, so right, packing arms and legs, we'll talk about tourniquets next, but definitely for any of those junctional injuries, neck, armpits, your groin, and then of course in the body as well, which is covered up down here. But right, we're going to pack any of those big wounds that are filling up with blood. Okay, in all three of these zones. So finally, our last part for C, compression, is a tourniquet. Okay, and a tourniquet is a device that's going to basically shut off the blood flow to an extremity. So we can only use these in our arms and legs, our extremities, but they are significantly proven to really save lives, and we can leave them on there for quite longer than we used to think. Back in the day, we used to say, oh, tourniquets, only put it on unless they're about to die because they'll lose the limb, they could get really sick. Turns out that that's not actually all true, because when you go into a surgery, they put a tourniquet on your knee, on your leg, right, if you're getting a knee replacement, for hours, and you don't get your leg chopped off. So they found, and through a lot of research the past 10 years through our the war in Iraq and Afghanistan, the science shows that putting tourniquets on saves lives. All right, so how do you put on a tourniquet? Well, you want to do 2 to 3 inches above the wound. Really, you want to go as high and tight as you can. So really, if it's on your arm, get it all the way up towards the top of your humerus here in your arm. Same thing in your leg. You want to get it up towards your thigh. High and tight, right? As high as we can and as tight as we can. So never want to put it on a joint, all right? Because the whole idea here is we're basically closing something really tight to compress the artery against the bone. All right. So if you do that in your knee or your elbow, you're not going to be able to put pressure on that artery. Okay. And you are going to tighten that tourniquet until bleeding stops. All right. Basically as tight as you can get it. You're never going to ever take the tourniquet off. Okay. Because once you take it off, you're going to start bleeding again. And that's definitely not good. And of course, it's important to remember that you can put a tourniquet on over clothing, but you want it to be light clothing, right? The closer we can get to the body, to our skin, the more pressure that tourniquet's going to put onto the extremity to try and stop that bleeding. So if somebody has even a sweatshirt like this, I would take it off. A big puffy jacket, definitely take it off, or big puffy pants. You want to get as close as you can to the body to try and put as much pressure. And then, of course, because we're shutting off blood flow, there is going to be a lot of pain. Okay, that patient's going to be in severe, severe pain. So that's why you called 911. EMS is on the way. They'll be able to help control that pain. But no matter how much the person might yell and scream, you cannot take that tourniquet off. All right. So the thing about tourniquets is you could put them on yourself. You can put them on the other people. Most of the modern commercial tourniquets now are designed that you could do it to yourself, because if you are like a law enforcement officer, let's say, and you need to put it on yourself, you have to be able to. Same thing if you're just a Joe Schmo out in the woods hiking and you need to put on a tourniquet. So again, you can put it over clothes, but try and get down to bare skin if it's big, bulky clothes. It's important to remember that we could use 2 or 3 tourniquets on a limb to try and stop bleeding. So one tourniquet may not be enough. We may have to put 2 or 3 before that bleeding stops. And we'll watch here how to put a tourniquet on. So we could pretend that this gentleman has a severe bleeding down below here. So we take the tourniquet, we put it around, bring the strap through the hole here, and you'll see she's going to put it as tight as we can. It's really important to get this super tight before we start spinning it. You can see she pulls it really tight. Look at the how deep it is already before she's even turned it. So this is called your windlass, and basically it's a stick, and you're going to start turning it, okay? And you will keep turning this as far as you can go, and hopefully the blood flow will stop. All right, once you stop that blood flow, you put it in the little bracket here. Bring the strap over to lock it in so it does not release. Flip this little strap over as a secondary. And you'll see right here it says time, right? So she's going to write the time that she puts this tourniquet on. And that's really important for when this patient gets to the hospital. They know how long this tourniquet has been on. Has it been 40 minutes? Has it been 7 hours? And that's going to help them determine how they're going to treat this injury and this affected limb. A couple things to note, right? The blue here is a training tourniquet. So if you ever see a blue tourniquet, that you cannot, there's no pressure on this guy right now. All right. So you cannot use a blue one on a real person. It's not going to do anything. And quite the opposite of that, right? If you see a black or like an orange tourniquet, which are real, you really should not use that in training on another person because that could shut off blood, it will shut off blood flow to their extremity and they could actually get kind of hurt or damaged and it'll be very painful. All right. So again, really simple here. How you see you get it really tight, the strap, you spin that windlass as much as you can until it stops, until the bleeding stops, strap it down so it doesn't release and mark the time. Now, if on this patient we needed a second tourniquet, you could do one up here. You could do probably 3 up here. If you had to do another one, I would go below the elbow down here. All right, so these are some of the commercial tourniquets out on the market, and these are recommended by the Committee on Tactical Care and Trauma and all the organizations that created this course at the beginning. And there's some really cool ones, and there's a bunch of other ones out there. Probably the most common one, which you saw in the video, is the cat tourniquet. And again, it's important to remember that all these tourniquets have some sort of strap, right, to tighten, and then or to get it snug, right, and to do the compression. And they have a windlass or some kind of stick or tightening device to really cut off that blood flow. So on the cat tourniquet, you can see here, right, that's one in the video. It's got the strap, the windlass here. The soft TT, same thing. It's got some type of windlass here. The SAM one I really like. You have these other ones that are kind of like buckles that you can tighten up. So there's many, many, many different devices on the market. And again, these are some of the names of some of those recommended limb tourniquets. And again, here's some of the pneumatic limb tourniquets, which are air-powered. And you'll see most of the times, and especially in schools now, we have these stop the bleed kits, which are near the AEDs. And the stop the bleed kits are going to have basically everything you need to stop bleeding. A pair of scissors to remove clothing, at least one tourniquet. They're going to have that quick clot we talked about all the way at the beginning of the video, which has chemicals on it to help stop bleeding, and probably some type of pressure bandage too. Okay. So a lot of times the question comes up, well, we're talking about adults, but what about kids? So for most kids, except for the tiniest infants, bleeding control is going to be the same, right? It comes down to that pressure, packing, and tourniquets, okay? Especially for a small child or infant, if the tourniquet is too big to go on there, direct pressure on the wound will work in almost every case, all right? And for large, deep wounds, you should be packing it just as you do in adults. Just do the same for children. Okay, some frequently asked questions. So what about impaled objects, right? If you have something like a metal stake or a knife or something stuck in there, okay? We do not want to remove the object. You can control bleeding as best you can by putting pressure around it. But EMS and when they get to the emergency room, they'll take care of that. Do not pull out an impaled object. Just put pressure around it. The big question list comes up about improvised tourniquet. tourniquets, right? Using some sort of object, some cloth laying around to try and make one. So unless it's one of these things, unless you practice it very frequently, it's very hard to be good at it. So as a first responder, a medical professional, you might practice making them. And if you don't have a commercial tourniquet, you can make an improvised tourniquet. Again, the commercial tourniquets are highly preferred. But for the average person on the street, you're actually better off just doing direct pressure and wound packing if you can. Especially if you were to try and make a tourniquet or a pressure bandage out of something really thin, like a piece of rope or wire, it can actually cut into the appendage to the extremity and actually do more damage. All right. So, loss of an arm or a leg, that's always a big question that comes up. Again, it's twofold. There's a lot of research out there that shows that you can have a tourniquet on for a very long period of time and not lose an arm or a leg. And at the same time, while that's out there, it's important to remember, well, what's worse, being dead or losing an arm or a leg? I would think most people would still appreciate their life. So that's out there with losing an arm or a leg. And we talked about pain. There's going to be a tremendous amount of pain. So make sure obviously you called 911 already. We're going to treat that as soon as we show up. And again, if you have other questions that came up during this lecture, be sure to ask them when we do the in-person practical version. So again, just a quick summary, right? Make sure that your scene is safe, you're safe when you're treating somebody, and then the ABCs, right? Alert, so call 911. B, find the bleeding, and then C, compress with pressure and or packing, all right? And then compress with a tourniquet if you have an extremity, and then make sure that help is on the way. All right, so I hope you guys enjoyed this. If you want more information, go to stopthebleed.org and look forward to doing the practical stuff together and learning how to stop bleeding in class.